Hello, I'm Dr. Wendy Smith, Director of the Family Nurse Practitioner Program. And today I'm going to be talking to you about different forms that are necessary to be filled out for your graduation paperwork. I'm also going to be talking about other paperwork that you'll need to recall and remember and how to fill out and what to do with it, because even though I tell you now, when you've got through graduation and you're getting ready to be completing that paperwork, you sometimes forget. And if you need to, then you need to call me. But I'm hoping that with this being web streamed, you'll be able to not only see the forms, but also get the information and be able to remember it for when you're on your big journey as a graduated MSN FNP that is fully certified by the Board of Nursing and fully certified by a national organization. You'll have your furnishing number, etc., etc. So I'm going to start to begin with what you need as far as your university paperwork. I've talked to many of you already, and we've gone over this in the 550C orientations. This first part, let me remind you certificate people who will be watching this, that this first part doesn't entail you. You don't have to fill out any university paperwork. This is for those students who are MSN graduates that are going to be graduating from the matriculated FNP program and who will be getting the Master of Science in Nursing degree with, note, the Family Nurse Practitioner specialty. One of the forms that everybody has filled out, and I'm going to be switching back and forth with the Elmo, etc. One of the forms that you do need to fill out is the degree completion program. And that is called an application for award of the master's degree. And let me find it here in front of me, and I will show you what it looks like. Okay, well, I had it a minute ago, and as in all instances, no, I cannot find it. But it's the two-part NCR form. All of you have filled it out. The last date to fill it out was, I think, February 15th. So you've completed it. You took it over to Admissions and Records, and in most instances, they send you back the yellow NCR, no carbon required form, and you on there it says what you want your name to be on your diploma, what your degree is, which is Master of Science, and what your specialty is, FNP. And that's how your name will be posted to your degree. So all of you should have already have done that. And in 550C, we talked about it in detail. It's the two pieces of paper. One is yellow, one is white, and it is called Application for Award of Master's Degree. Okay, so that is that form. The second form is the GSO1. And the GSO1 looks like this form. I'm going to just switch here to the document. And you can see that it's called Advancement to Candidacy. I think you've all filled this out. What I'll be doing in the next week or so is putting together a list of people and checking off, yes, Wendy Smith has submitted her GSO1. And if there's anybody that is on that list that I don't have a form for, I will be getting in touch with you. This Advancement to Candidacy form, again, it looks like so, is a form you need to fill out, and it's kind of an alert to the Office of Graduate Studies, and it alerts them that you are getting ready to graduate. You've advanced to the candidacy level, i.e. you're ready to take your final comprehensive exam. You're in the process of finishing all your coursework, and you're ready to graduate in May. So that is the GSO1. I have given you instructions in 550C about what to put on that form, and everybody that has filled it out so far has done a great job. So thank you. The other form that you need to fill out is called the GSO2. And the GSO2 is another, the title of it is Completion of Requirements Form, but we call it GSO2. The GSO2 looks like this. So here we go. Completion of requirements, see GSO2 up there, and you put your name in it, and then there's a list of the courses that you have taken. You must put the number of units that that course was, and your grade in that course, and the semester taken, and the place you took it. Now, some of you may be transferring in courses, and you know who you are. So if there are courses that you will be transferring in towards a degree, you will need to include those on this form, and you will need to put in the semester. You can put them in the semester that they would have fallen within your cycle, or the semester actually that you took them at the school that you took them at, and the actual place. So if some people took a course, say, at a University of San Francisco, you would put, spring 2006, and you would put USF. Now, if you do have courses like that, what you will need to do is put those, request a transcript from those institutions and make sure it's on file here at the university. Because what happens with this form is the Office of Graduate Studies will look at this form, and they will look for your transcript, which is on file, and they can pull up, and they will make sure it all matches, the grades, the semester, and that you have a total number of at least 40 units, because 40 units is what is required for the award of the master's degree. So they will look at that, and they will match your transcript with these courses that you claim you have taken. And we know you have taken them, believe me. So if you have taken courses from another school, make sure that you definitely include those on the form, the semester taken, and that those transcripts are on file here at Sonoma State University. Okay, so let's just go back over that. This is please note, this is for students who are graduating in May, and those students who are in our MS FMP program and who will be awarded a master's degree. And this is the graduation paperwork that you've needed. The first one we mentioned was the application for award of the master's degree. All that should be done, and that should have been in by February 15th. If you don't think you've done it, you better check with admissions and records to see if you have done it. And if not, get it in ASAP and write some kind of petition as far as why you didn't have it in on time. I have known people that have gone through the end of May and figured out, oh, I didn't do that, even though they were told to do it. And they did not have a May graduation date. They ended up having to wait and have an August graduation date. So, application for award of master's degree. It's an NCR form, and you get a copy of the yellow NCR piece. And it tells you that they have reviewed your files, and yes, you are on track to graduate in May. Now, the second form, remember, is called the GSO1. GSO1, here we are, Advancement to Candidacy GSO1. There's places for you to fill out, talk about how you're going to meet your requirements. You know how you're going to meet those. Comprehensive clinical simulated exam. Okay. When you have taken your exam, I will send that form over to graduate studies. And they'll know, oh, great, we've got this person on track and they're ready to graduate in May. Then, lastly, there's the GSO2, the Completion of Requirements form. Again, you fill it out, put your courses in, your grade. You should have minimum of 40 units. Some will have 42, some will have 43 if you include your N555 expanded clinical studies. It requires that you sign it, and then it requires that I sign it. I will sign it, and I'll be so happy to sign it for you. Right here it says culminating project, date, and grade, and I will put in there pass, which means once you have passed your comprehensive culminating clinical simulated exam, I will put a pass in there and you will be done, other than finishing the rest of your coursework. So 3 pieces of paper, 3 forms, 3 things that you need to be responsible for. Like I said, in the next week, I will put a list together. If there's anybody that I don't have forms on, I will let you know, at least for the GSO1 and the GSO2. The award of master's degree, the NCR form, is a 2-piece form, and that is your responsibility. Okay? Okay. Now, I just wanted you to know that the Office of Graduate Studies is where they will match your transcript with your forms, and they actually approve you for award of master's degree. That begins once all the grades are posted. And so you take your final exams, or you hand in your final papers, you go through graduation, and then over the next 2 to 3 weeks, all that paperwork gets processed. And then A&R will get the information from the Office of Graduate Studies, and they will then post your degree to your transcript. We'll talk more about transcripts later and how to go about waiting and making note that you don't want your transcript sent until your degree is posted, because in order to get certification by the BRN, you have to have your transcript there and you have to have your degree posted. In order to sit for the ANCC or the American Academy exam, you have to have your degree posted to your transcript. So the Graduate Studies Office is who deals with these forms, who evaluates them, and then lets A&R know to post your Master of Science in Nursing with an FMP specialty to your transcript. Okay, so let me think about the next piece. And this part is for all students. So we've covered the part that's for the master's students only. And now we're going to talk about the piece that is for all students. So it's for master's and postmaster's certificate students. So, obviously you know who you are out there. So there are several pieces of paperwork and forms that you will need to complete, fairly detailed, through several different processes for the BRN and for your national credentialing agencies. So the first one I'm going to talk about is the BRN forms for certification as a nurse practitioner. Notice I do not say family nurse practitioner, because in California you are certified as a nurse practitioner. Now, in your practice, and if your practice were ever assessed or evaluated, you would be held to the level of the education that you have, which is family nurse practitioner. So, but when you get your certification from the Board of Nursing and your card that tells you you're certified as a nurse practitioner. It will just say NP. It won't say FNP. But you are held to your level of education. And that is why when we talk about people practicing within their scope of practice, the FNP has a greater scope of practice. People that have another nurse practitioner specialty, say, for example, a pediatric nurse practitioner, yes, they have NP, and they are a California NP on their license and on their certification. But in their practice, they're held to a pediatric nurse practitioner practice standard. So if their manager comes along and say, oh, I need to move you to the adult clinic today because we're short a nurse practitioner there, that would mean that you were practicing not within your educational scope or your general scope of practice that you have been educated to. So that is why the FNP tends to be a more marketable certification, for want of a better term. So this is for all people, masters and postmasters. You have to apply in California to hold out, that's the term they use, hold out to practice as a nurse practitioner. And one of the pieces that they need is a form called Certification of Nurse Practitioner. And there are 3 methods that you can certify to hold out, to call yourself a nurse practitioner in California. The most expedient way to do it is to graduate from an approved program. And we are an approved program, as all of you remember from last October when the Board of Registered Nurses was here to visit us and observe and check our programs and our curriculum, etc. And so we are an approved program through the California Board of Registered Nursing. As such, when you go to fill out your certification, you need to fill out Method 1. Now, you will need to go to the BRN site, which is www.rn.ca.gov, and then you look for the section under Applicant. It's at the tab at the top of the page, and then you go down to the part for nurse practitioner, and it will pop you into the nurse practitioner certification data. I'm going to make this available to you as a document. This is my notes that I'm reading from right now in 510 so that you can follow along with this informational session with the notes that I have. So this is on page 2. It's related to verification of nurse practitioner academic program. Remember, you will be applying for certification in California under Method 1. And Method 1 is a 15-page downloadable application. You can't apply online. You have to fill it out, print it off, and send it to them. But one part you do have to send to me, okay? And that is, there we are, page 8. You will send me this one page, because I don't want your whole 15-page application, this one page, and you will put it in a stamped, self-addressed envelope, and you fill out the top part because it has your information that you need to put on there. They do require a social security number and your mother's maiden name. And then I will fill out the bottom part, which talks about name of nurse practitioner academic program, etc., and the date you entered and the date you completed. The date you completed, I need to wait until your degree is posted to your transcript, and then I will put the date of the graduation in there, graduation day, and then I can sign it. I have to certify under penalty of perjury, so I take this very seriously, that you did complete the full program. So for people that are graduating in May, you will get this paperwork to me ASAP when you graduate, or you can send it to me prior to that and have it ready to go. I put it in a folder, and then I start filling it out, and when I check with A&R that your degree has been posted, I can sign it off and send it off to the Board of Nursing. Now, if you send a stamped addressed envelope and you want me to send it directly to the BRN, I can do that. And you can, in the meantime, send off your portion of your forms to the BRN with your check. Everything requires a check, at least once you finish the university paperwork. Everything requires a check, and there's a cost. And I'll send it wherever you've written on the front. Generally, like I said, by the time the final paperwork goes to graduate studies and it's checked, and I have to say graduate studies are very good about expediting the nursing, master's, graduate stuff, because they know those people often have jobs and are waiting to move into a position. So by about the second week of June, approximately, those degrees are posted to your transcript. That paperwork, then I can sign off on this form. I can put it in the self-stamped, addressed envelope, and off it goes to the BRN. Or you might want it to come to you and send your package as a whole. You can begin establishing your file at the BRN earlier, though, so that then we're just waiting for this one piece, and when this one piece gets there, voila, you're ready to go. So I recommend that people start establishing that file around about the beginning of May. Basically, you download the application, you fill out all the pieces of application, you comply with the information about the DOJ, Department of Justice, fingerprinting, et cetera, et cetera, et cetera. They do ask very pertinent and pointed questions about, especially if you already have an RN license, if you have had any activity, negative activity, for want of a better word, that would impact your application, and you have to fill out the form associated with that. But the process in a good year, from you walking in graduation to when you have that certificate in front of you, 4 weeks on a very good year, 6 weeks on another. And remember, the BRN is in a furlough situation and are furloughed 3 days a month. So that will impact this process. Shouldn't take longer than 6, especially if you have all the paperwork filled out, you've established your file, and then I send this form in 2.5 weeks after you graduate. So, now for people that are in the certificate program, they will graduate in August. Some will graduate in December. So think about this process and get this paperwork ready now while you're in this class and this process. Have it in a file, have it ready to go. So those in August will hand or send me this verification of nurse practitioner academic program, and say in July, and I can have it ready to sign off on because your nurse practitioner certificate still needs to be posted to your transcript, because you don't want any transcripts going out without that nurse practitioner certification on it, or Postmasters certificate program on it. So it's a similar process, doesn't quite take quite as long, but there's still a process. And you'll graduate in August, so it'll be like the middle to the end of August by the time this paperwork gets handled and the BRN is able to award you your certification. So you need to send me page 8. Let's just review that again. Page 8. Those people graduating in May need to have that ready to go by at least graduation. Some people just take time and take longer and don't have any rush and don't have a job necessarily ready to walk into. So sometimes they wait until they've graduated and recovered, for want of a better word, and then they send me this. But if you get it to me, and I can send it in as soon as possible. I need to wait till your degree is posted, and I do need a stamped addressed envelope, and I will send it out as soon as your degree is posted. Okay, so that is page 8 from the certification of MP education. And just as a note, I wanted to add the fact that if you go to the BRN and you look at what they say is a nurse practitioner, they say a nurse practitioner is a registered nurse who possesses additional preparation and skills in physical diagnosis, psychosocial assessment, and management of health and illness needs in primary care. There are 3 methods to qualify for certification as a nurse practitioner with the BRN, and you will be applying under method 1. Okay? So, when you're looking at this presentation, you'll be able to follow along in the paperwork. Okay, now we're getting to form number 2 for all nurse practitioner graduates, whether you're MS or you're Postmasters. And it's the nurse practitioner furnishing application. The BRN issues a furnishing number. That's what we call our ability to prescribe and offer medications and therapeutic treatments to our patients. Furnishing. Okay, so the BRN issues a furnishing number to a nurse practitioner that allows him or her to order or furnish drugs and devices, not just drugs, and devices to patients using approved standardized procedures. Okay? Standardized procedures, part of those standardized procedures are process protocols. That's what you're learning to do and working with and actually developing in 510. So, you cannot furnish if you do not have standardized procedures and process protocols. The other process that people have used is the transmittal order. And that's where you get a second party to call in the prescription. But you can't use your name. You have to use the doctor's name as part of the transmittal process, unless you have a furnishing number. Then you can use the transmittal process. But if you don't have a furnishing number and you are not operating from standardized procedures and process protocols, which is the type of protocols we use, then you can not use your name on any form of prescription, etc. So, a nurse practitioner with a furnishing number may obtain a Drug Enforcement Administration registration number. That's your DEA number. And that will allow you to prescribe, furnish scheduled drugs. Again, you need to go to the BRM website, follow the procedure I just mentioned under applicant, and then go down to nurse practitioner, and it will say nurse practitioner furnishing number. There, it's an 8-page application. You can open it, fill it out, and then print it. You can open it, print it, and fill it out. There's only one page you need to send me, and let me see what that is. Here it is. And it looks like so. It's similar to, see? It's similar to the previous form, but this, on the top of it says Nurse Practitioner Advanced Pharmacology Course Verification. In order to have a furnishing number, you must have taken an advanced pharmacology course. And all of you did. It was Nursing 552 Pharmacology for FNPs. So you fill out the top part, and this is the exciting part. It talks about your California RN license, and then it asks you for your nurse practitioner number. And by then, you will have it, and you'll be able to put your nurse practitioner number in there. And then as we move down the form, I fill out the bottom part, okay? But please, you fill out the top part. Sometimes when I have 30 graduates and I'm filling out multiple pieces of paper on each one, I'm up to 90 pieces of paper before we're through with the whole process. So I will fill out the bottom part, and it talks specifically about what the course was called and if it was this many units, and okay. We'll have dates. Started exactly. We'll take care of the part, but you need to fill out the top part, okay? Now, I would recommend that you not worry about this until you finish your supervised hours. Okay. I'll talk about that a little bit more here. So you'll send me page 4 of this application, nurse practitioner furnishing number, and you'll fill out the top part, and you'll sign it. Please don't forget to sign it. You'll send it to me with a stamped addressed envelope included, and that will tell me where I need to send it to. Some people have me send it directly to the BRN, and others have me send it to their home, and they include it as part of their package. But again, you can send your own piece of the package off, and then I can send this one page if that is what you wish. Just let me know. So make sure you sign it, and then on there, as part of the package, one of the pieces of the form, you have to have your supervising physician sign it off. Now, in some clinics, you might have worked with several physicians, so in that instance, you just need one person to sign you off. Clinical director, it has to be a physician. It can't be a nurse practitioner. Unfortunately, it has to be a physician. So, when you start putting numerous physician names on this form, it gets confusing to those people that are reading the forms and making sure that you've dotted your I's and crossed your T's and you filled out this box and that box. So the point being that you really need to make sure that you have the supervising physician's name on there and they sign it. Okay? Now remember, you need 520 supervised hours. Okay? And we can talk more about that later too. Those hours, the physician can be in another part of the clinic. They can be in another entity. They are supervising your furnishing. And when you are, before you have your furnishing number, all you can do is either get a prescription signed by the supervising physician or do a transmittal order under the physician's name. So you need to talk about these pieces of how this is going to work when you get into your job, or prior, actually. You need to negotiate these as part of that contract that you're working on in 510. Very important piece. How is this process going to work for you in your clinical setting? So 520 hours, that's 10 hours over 1 year, 20 hours over 6 months. What I see is that most people get it within those hours within 6 to 7, sometimes 8 months of their graduation date. So it's important to have. You need this number to get your DEA number. Okay? So that is your advanced pharmacology verification paperwork, and I fill out the one piece of paper that talks about what course you took, exactly when you started and exactly when you finished. So again, I sign that, and I sign it in all seriousness because I do certify that under the penalty of perjury, I am verifying that you in fact did take this course and that you are who you say you are. So two things that you need to send to me. One, right before or around graduation, is the application for certification and as a graduate of an approved program. Certification in California as an NP. Then 6, 7, 8 months into your practice, you'll be sending me the nurse practitioner furnishing number application. Okay? 2 things. Now, for each of those processes, you and only you, I feel like Smokey Bear, But I'm not preventing forest fires. I'm preventing stress, because only you can order your transcript. Okay? Some people get very frustrated that they send all this paperwork in and then they get a note saying your transcript's not on record. We, Sonoma State as an entity, cannot send your transcript to anybody that you do not authorize us to send it to. And it's not me, it's Admissions and Records, because I am not the repository for your transcripts. Admissions and Records is. So what you need to keep in mind is that you need to have a transcript submitted to several places. The first one being the Board of Nursing for your NP certification. Second is the Board of Nursing for your pharmacology and your furnishing hour supervision verification. They're two different transcripts. They're sent at usually 2 different times. And please note that you need to put a hold on it till 1, all your grades are posted and your degree is awarded and posted to your transcript. So I'll remind you about that later. Okay, because I got a very interesting letter from a graduate that said, "You never told me this. I didn't know this." And I thought, well, I thought I did, but that's why I'm making a special note so that you know all about it. Okay, so that is for both master's and postmaster's students. Both of those processes you need to complete. Okay, the next situation is if you are going to be sitting for the national exams. There are 2 different entities that produce the exams or produce a method for you to sit for the exams. The one is the American Nurses Credentialing Center. It's, according to them, the world's largest and most prestigious nurse credentialing organization and a subsidiary of the American Nurses Association. They do credential the most numbers of people. They do have their exam processes down very well. They tend to be more fluent in the process and easier to access as far as the process. There are a couple of steps that they require in the process, like another piece of paper or transcripts or something else, something for me to fill out, that the American Academy does not require. But I have to say that I get more calls from the American Academy of Nurse Practitioners and their certification program regarding this student X, student Y, blah, 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 and where they did their clinicals and if they've got this on record and that course on record, than I do from the American Nurses Credentialing Center. And we actually have our own number. Our school has a number that you put in to your application, and our curriculum's on record, etc. But anyway, so this is, and actually this, what I'm showing you here is in gray, but I think it's a very bright color, and it's the ANCC eligibility criteria for the family nurse practitioner. And you go to the ANCC website, which I have in this written part, and it talks about the paperwork and the necessary requirements for sitting for the exam, etc. And again, it's the American Nurses Credentialing Center. And I have that URL in the notes that I'll be posting. So, in order to take the Family Nurse Practitioner certification, the eligibility criteria are as follows. It's a computer-based exam, as is the American Academy. And when you pass it, you will be eligible to write your name, Wendy Smith, RN, FNP-BC, board certified, and then your other degree, MSN, or whatever your degree is. But you must hold an active RN license in the state that you're practicing. You must hold a master's degree, a postmaster's, or a doctorate from a family nurse practitioner program accredited by CCNE or NLN. We are accredited by NLN. You must have a minimum of 500 faculty hours. You know we have at least 672, and most of you will have more because you have actually taken the expanded clinical practice class, the 555. You must have taken a course in advanced health assessment. You have 509, also 549, health maintenance practicum. You've taken the pharmacology course, and you've taken pathophys concepts in 540A and B. You must also have a course in health promotion and disease prevention, 501, and in differential diagnosis and disease management, 540A and B. So I've given you the website. You go to this website. You can download the application. And there is a page that I do need to sign. Actually, it's 2 pages now. It's expanded from 1 to 2. And it's in section 4. And let me see if I have that on hand to show you. Here it is. I'll go to the document camera. And this is what it looks like. The validation of nurse practitioner education program. You can see it asks your name. Please fill out as much of this as you can and you know. It talks about the university. It asks for the school code. When you go in, it's just a pop-up and you just look for the school code. I think it's 0325. But you can find that on the site. And then you can, if it's NLN accredited, the program name, and etc. Telephone number, please fill out the top part. And then the date that you graduated is the date that you actually, for MSN, walked in the ceremony, or that date of the commencement. And, of course, we're not a dual program. And then again, it has the type of program and the date it was conferred. And then it talks about what kind of program. And then I usually fill out this bottom part, though, or it talks about indicate the separate course numbers and titles for the graduate content. And this was the content I was talking about. Advanced health assessment, advanced pharmacology, pathophys, etc. NP role. It goes into numbers. But I will fill out the form from that part on. So if you can fill out at least that first page, it's a big help to me. And then I will fill out the bottom part of the first page and put all the data in there that needs to be in there. And then I will sign it and send it off in a stamped, addressed envelope to, if you want me to send it back to you so you can send your whole package in together, that would be fine. If you want me to send it directly to them, usually the ANCC likes the whole package together. So, and I can do that for you. The other site, or the other entity, is the American Academy of Nurse Practitioners. And I'll put this up for you so that you'll know what it looks like when you go there, if that's where you want to go. So, American Academy of Nurse Practitioners Certification Program. National Competency-Based Certification Exams for Family Nurse Practitioners. Both exams are fairly similar. Essentially, it's the same cadre of nurse educators that are involved in the process for writing for both exam items and questions. again, both of these processes cost money regardless of who you go through. And the American Academy does not require me to fill out any paperwork. However, some of their paperwork is a little bit more complicated as far as knowing hours of didactic exact for clinical or theory courses, etc. So sometimes I'm called upon to assist in that process. And sometimes people send their paperwork in, and then I get phone calls from the gentleman that's in charge of verifying the credentials or the data for giving you a test number. Each of these entities are computer-based. Each of these entities costs money. For each of these entities, you need to fill out forms, send them in. They give you a registration number and tell you who to contact to take the test. Both of the tests can be taken through Silva Learning Centers or other testing centers. And essentially you get a date window, and you have from X to Y date to take this test. And so you call the testing center, and whether it be Sylvan or whatever it is in your neck of the woods, and they will certainly, you can arrange a date, and then you go in and take the test. One says it's competency-based. One, says it's the largest credentialing agency for nurses in the world. Why do we have two? What were we thinking, right? Well, originally, nurses were educated to be nurse practitioners at a baccalaureate level, and then all those processes changed, and we ended up where it became a master's level, and now we're even moving to that other phase, at least for national certification. Okay, ANCC, the American Nurses Credentialing Center, moved to saying in order to sit for this exam, you must have a minimum of a master's degree. The American Academy of Nurse Practitioners said, no, having a master's degree doesn't confer competency, and we're going to have a competency-based exam, and we're going to create our own exam. And so they created an exam, and you didn't have to have a master's degree to sit for that exam. And American Nurses Credentialing Center created an exam that you had to have a master's degree. Now for both of them, you have to have a master's degree. So it doesn't matter which one you take. By maybe 1%, we have a higher pass rate on the American Nurses Credentialing Center. Some certification review courses recommend one over the other. If I was forced to state my preference, I probably would be stated as the American Nurses Credentialing Center, but the Academy is just as viable and just as appropriate. When you do the American Academy paperwork, you do need to know where you did your clinical practice and the person you did it with and how many hours you did in each of those different clinical practice sites. So make sure you keep that data. American Nurses Credentialing Center, we verify coursework, we verify total clinical hours, and because we're an approved program and we have our own number, they accept that. Okay, but American Academy does not require me to fill out paperwork, but then, like I said, they usually call me and I have to explain what students have put on the paperwork. American Nurses Credentialing Center, I have to fill out a piece of the application paperwork, and it's Part 4. So you just send that to me in a self-stamped addressed envelope, and American Academy, you just fill it out, send it in. So those are the two national exams. Okay? It's not American Nurses Credentialing Center say they're a credentialer, but really you're credentialed by the entity that you're working in. That's when they talk about credentialing, that's the process where the person in that entity, the manager, the risk assessor, the human resources director will send paperwork to me to credential you to work in that site or entity. Most of those situations where I have to do that are large entities that have some hospital-based or hospital-focused piece to them, i.e. Sutter, Catholic Healthcare West, Kaiser, etc. Not that you would even be practicing in the hospital, or that you might not be. I mean, some instances you are, but that credentialing process is done by the entity in which you are going to be working or hired. So it's kind of a little bit of a misnomer that the American Nurses Credentialing Center is really a certification, much like the certification for the BRN, but it is a totally different and separate entity. Okay, so those are the two pieces that you need to think about for national certification. Once you have national certification, then you can apply to Centers for Medicaid and Medicare, CMS, for your PIN number. That is the number that you will be able to bill for your services under. And keeping in mind that nurse practitioners can bill for up to 85% of the services that are delivered by an NP versus an MD. However, there are some situations where you can bill for the whole entity if it's a nursing focused visit versus a advanced practice versus a medical visit. The other issue as far as certification is you have to apply for that PIN number from the Centers for Medicare, Medicaid, just like you have to apply for the DEA number. So, the BRN, you need to apply for the certification, and that costs some money. For the BRN, you have to apply for your furnishing number, and that costs some money. For the National Certification Exam eligibility, you need to pay for the ability to do that. You need to pay for a DEA number, and you don't need to pay for a national PIN number. So that's it. So whichever entity you choose to become nationally certified / credentialed in, both are perfectly fine and are, have reciprocity through all states, U.S., Canada, etc. So, and in other parts of the world where nurse practitioners are now becoming a larger part of their care system, i.e. the United Kingdom, Australia, New Zealand, so they recognize the American Nurses Credentialing Center and the American Academy of Nurse Practitioners certification exam. So, that's a lot of things to remember. The next thing I want to talk about is a certification review course. People ask me, do you recommend I take one? Should I take one? What do other people do? How does it work? I think that depends on the type of person you are. If you're able to carve out pieces of time that you can give to studying for the exam, there are CDs, there are DVDs, there are books, tapes. People still have tapes recorded to listen to. But anyway, there are multiple ways to prepare for the exams. When I took the exam, which is just a few years ago, mind you. No, that was a long time ago. They didn't have certification review courses, and I just carved out Saturday morning, and I studied Saturday morning for about, 6 months, and then I went and took the exam. They didn't even have review books. But now they have a lot of different pieces that you could use either solely or to augment or in addition to, etc., the review course. We have hosted at Sonoma State a national review certification course here in Rohnert Park, which is really nice. And it will be this year from July 30th through August 1st. It's very comprehensive review. The people that do it are brilliant. They are not only great people, but they really know how to work with you and get you to identify what areas you need to focus on specifically for the exam. People that have taken this course have consistently passed on the first time take. If you take the course and unfortunately you don't pass, then you get to take the course again free. Emily Hollier is the speaker, the teacher, the person that presents the material, and she really has won many awards for her ability to present and synthesize your whole FMP program into several days and focus on what you need to think about and how you need to go about studying and working towards taking the exam. We have a URL to connect to this on 550C and 555, and I'll have the URL in these notes here so that you can click on it and arrange, take the course here, or maybe you want to go somewhere really nice to take the course. You know, there are other entities, Fitzgerald Associates, that do courses while you go on a cruise or while you're in Hawaii or while you're in Florida, etc. So there are many ways to deal with this. One is to come here in Rohnert Park and take the review course. So that is that piece of it. The other part I wanted to just reiterate is for the applications for the review course, no matter which entity, American Nurses Credentialing Center or the American Academy of Nurse Practitioners, no matter which one you do, you'll need transcripts sent because they have to ascertain that you have indeed graduated. And yes, it's fine that I sign it off, but they have to see it in writing just like the BRN does. So make sure you have a transcript sent for the different entities to either one after your degree is posted or after your Postmasters FMP certificate is posted. So now people that are graduating in August or December could certainly come and take the course this August. So, or they can wait until the following August. We're hoping that this will become, well, for the last 5 years it's been an annual event, and we're hoping that we're going to continue that over the next few years. We provide a room, we provide the services on campus, but the process of registering and the process of paying is not under our purview, and we have no control over that, and that is between you and the review course, whatever review course you take. Okay, I just wanted to talk about transcripts again. You'll need to submit a transcript, as I said, to many entities, VRN, for certification and the furnishing verification to the certification entities. Okay? And as I've told you, please, you request it, and when you're requesting it, you can note when you want it sent, i.e., you can put a hold on it until certain criteria are met. Okay? So, and that is until your degree is posted and your grades, your grades are posted and your degree is posted if you're a master's student. And if you're a postmaster's certificate, until your grades are posted and your certificate is posted to your transcript. Okay, sometimes I recommend that people have, order, one for each of these entities, and then, have 5 sent to your house in a sealed envelopes, and then you can always include them later because many places require them. Sometimes the position or the job that you're taking might require a transcript, especially large entities like the federal government, etc., state government. Sometimes they require a transcript. So that would be the way to go. Plus, you never know when you're going to need it for something else, and maybe you'll be applying for a National Health Service repayment loan, and you'll need a transcript sent. And there you'll have it in a sealed envelope. You can just put it in your application and send it off, etc. Okay, so I was looking for something that's very important. Oh, here it is. And I want to put this before your eyes because I want you to think about this and just focus on that. Hold on, I've got to go wide. There we are. Okay, because I'm going to talk about graduation. I've also included the URL for the university link for University Affairs and Commencement on the notes that I will post. For us in the School of Science and Technology, our commencement will be on May 29th, 2010. The ceremony will begin at 9 a.m. and will go till approximately 12:45. And then after the ceremony, we have a reception over in the quad near what I call Bacon and Eggs and Toast. That sculpture over there in front of the School of Science and Technology. We have a reception within the main lobby there and out front to meet your family or your significant others, loved one, friends, whoever you want us to meet. And it's such a wonderful day, very much. When you come to the day, come early. 8 o'clock's not too early. 8:15 maybe. Park. Kiss your loved ones farewell. They will need to go to the ponds, and they will sit there, get seats in the bleachers. We're in the morning, so if it's a really hot day, it's morning, so it's not too bad. In the afternoon, it gets very hot. It has rained once on graduation, and the ceremony was cut short, and everybody got soaked, but that's once in 25 years that I've been coming to graduations. So you will be in Nichols Hall. We'll help you put all that regalia on, as they call it, and you'll notice they have the mortar board, and they have their tassels, and they have their gowns, and their sleeves are slightly different than the undergraduates. Many of them have their Sigma Theta Tau honor cords, and then they have the gold or peach. Actually, peach is a color, but it's gold when you're ordering it for the Master of Science hood. Okay, so you want the Master of Science hood. You can order your regalia from the bookstore. They used to rent it, but it was such a to-do. And so now you just buy it. I'm not sure what the cost is, like $40 or something like that. And if anything, it'll be great for your kids for Halloween, or when you're faculty and you're walking and being in commencement with your students. So what you need to do is get here early so we can help you put on all that gear, regalia. It's a very, very fun time. And if you come early, we can help you. I advise you to make sure that you give your family your purses and all your belongings and all the stuff that you have, because you don't want to be carrying it in while you're walking in regally with your diploma holder. Now, you will line up, as you see those people in that picture, I'll go back to the picture in a minute, outside Stevenson Hall, which is on the north side of Stevenson, just in front of Nichols Hall. That's where the nursing department is. And you will line up there, and they give you a green card, and you put your name on it, and you know, spell it phonetically, just how you want it pronounced when you're up there, and everybody's name is announced, and you walk up and shake the hand of the president or person who's the designee on the other side. You come up from both sides. You will march in first of all the graduates. Masters of Science walk in first, and you will sit on the front rows. And it truly is a really glorious time, and just a really wonderful closing piece to all the hard work that you have done over the past 2 to 3 years. We welcome Postmasters certificate people. You know, you made really good friends, and you become part of the cohort. And last year, 2 certificate people came and marched in the ceremony, and it was really wonderful to have them there, even though some of them, you know, don't get finished till August. So also wear comfortable shoes, because you're walking on this grass, and after several thousand people have walked on it, it gets a bit soggy. Like I said, you will be lined up there. You'll march in under the banner of the Masters of Science, School of Science and Technology. You sit on the front rows. You'll be the first called up to get your degrees, and then you will move back to your seat and wait until they get through about 1,000 other people. But it moves fast, and we have a couple of speakers, and then, like I said, the faculty will leave the processional grounds first, and then we wait for you, and you walk through our little alley that we make, and we congratulate you there, and then we meet you over in the School of Science and Technology foyer and in the foreground there. So that's Saturday, May 29th, 2010. And like I said, the regalia, you can order from the bookstore and until May 10th. And so I've included that information on this notes that I've made, and I just want you to kind of just take a minute and picture yourself, you know, visioning yourself graduating and thinking about where you're going to be moving on to when you graduated. What are you going to do? You're going to have that portfolio ready to go. You'll have your contract done. You'll have your process protocols done. You'll know how to interview. You'll have those things ready. You'll have the portfolio of your clients from your Typhon database for the last year, at least. And certainly you could write a little narrative to attach that, talking about the fact that this was instituted in the last year of your program. For certificate people, it's been every semester, so that's why it behooves you to get all your data in there so that you can present that it's it'll be such an expanded part of your portfolio as far as types of clients seen, procedures done, etc. But these are people from Stanislaus, and this is those are all the Stanislaus group from a year or so ago, and you'll be standing there waiting for faculty to take your photos before you march in, and then we see you be awarded your degree. Like I said, it's a very, very rewarding day for you and for us as faculty. It's just wonderful. I think I've really covered all I wanted to. Like I said, I have the notes to everything I've said in this lecture, and we will post this along with the web streaming in 510, and you can see me talking to you about these wonderful issues that, and they are wonderful because they represent, a culmination of your efforts and your work over the last 2 to 3 years, and we'd like to celebrate that with you. So that's all I have to say. I am looking forward to seeing you and your families at graduation, and thank you very much for listening.